Hi, I'm Tamaria Mitchell, and this is my week 7 lab video.
Hi, Courtney Banks, and I give her permission to record. Come in.
I'm performing hand hygiene, putting on my gloves. Hello, Mr. Banks. How are you today?
Good. How are you?
I'm doing good. Thank you for asking. I'm Tamaria Mitchell. I'm a student nurse at Chandler University, and I'll be doing a head-to-chest assessment on you today. It will take no more than 20 minutes tops. Will that be okay?
Yeah.
Alrighty. Are you having any pain before we get started?
No.
Okay, good. So the first thing I'll do is check Mr. Banks if make sure he's alert and oriented. So by that, I'll ask for you to state your name,
Quentin Banks.
date of birth,
September 26, 2006.
and what is the month currently.
October.
Alrighty, and as well as where are you?
Home.
Yes, good enough. So the next thing I'll do is just on inspection, I'll look at him and notice his posture is upright, so he's not hunched over or any such thing like that that will raise concern. As well as he did have a shirt on, so he was dressed appropriately. His mood is pleasant, as well as he didn't have trouble sitting on my bed, so that shows good mobility, and he looks well nourished. So the next thing we'll do is we'll look at Mr. Banks' skin more closely. So I'll feel him with the back of my hand, and he's warm, and as well as his skin is soft. And I also look at his chest and notice in his skin in general and look that his color is appropriate for his ethnicity. Then I'll palpitate around, make sure I don't feel any lumps or bumps or indentations. And I look, as I'm doing that, I'm looking at his skin to make sure I don't see any like lesions or any signs that, like bruises that would raise concern, and I don't. No pain or anything when I feel?
No.
Good. Okay. All right. So that was good. Next thing we'll do is check his nails. And his nail beds are round and as well as firm and smooth. We don't want them to be rough or spongy. So that's good. And his capillary refill is less than 2 seconds. So that's good. All right. And the next thing we'll do is check his head. So we'll move on to his head and make sure that it's symmetrical. I'll palpate around. Any pain? No? Good. All right. And then I notice that his head is symmetrical as well as eyebrows and smile. And smile, and his smile is symmetrical as well. So that's good. So the next thing while I'm on his head, I'll check his lymph nodes. So I have you turn this way so you can see. And I'll announce them out loud. So preauricular, postauricular, occipital, submental, submandibular, jugular-digastric, superficial cervical, deep cervical chain, posterior cervical, and then I have you shrug your shoulders, supraclavicular. And I'm not feeling anything, which is good. You don't want to feel the lymph nodes. Alrighty. Next, we will look at his eyes. Alrighty, and I'll use my pen light for this. But first, we'll look at me, and I notice that his irises are brown, his sclera are white, his pupils are round, and as well as look up, pull this down. His conjunctiva is pink and red, so that's how we like it. And next, we'll check and make sure that his cranial nerves 3, 4, and 6 are intact by doing some eye tests. So first, I have you keep your eyes on the pen and just follow it, okay? Alrighty, and then I'm gonna shine a light in your eyes. Look at me. Alrighty, and look at me. Alright, now keep your eyes on the pen. Alright, so he passed the Perla test. So Perla means that your pupils are equal, round, and reactive to light and accommodation. So it's good. So the next thing we'll do is we'll move on to his ears. So I'll palpitate around his ears and look for any lesions or any such like that, which I do not see. Do they hurt at all? Tenderness? Good. And so next I will look in his ear with the pen light to make sure I don't see any redness or like discharge or inner lesions, which I do not. All right. So next I'll move on to his nose. His nose is symmetrical. I'll palpate around. Does it hurt? All right, good. And now I'm gonna cover one nostril, breathe in, out. All right, good. another one. Out. Alright, so his nostrils are patent. And next I have you look up. I look in his nose and I see no redness, lesions, or discharge. And I also notice that his septum is not indented or anything such like that. Sticking up. Holding on strong. Alright, so the next thing I'll do is I'll look at his lips. So his lips are no signs of no lesions, they're not cracked, they're moist and pink. Next I'll look into his mouth. Open his mouth. And I'll look around. His teeth are white. He also has braces. His gums are tight around his teeth and also pink. I also noticed that his buccal mucosa, the soft palate, which tongue, the hard palate under his tongue and the back of his throat is wet, pink, and glossy. Go ahead and put your tongue down. I lost my tongue compressor, so we'll just pretend like my finger is it. He's my brother. He won't mind. So I look back, I hold the tongue down and say ah. And his uvula rises when he says ah, so that means that cranial nerves 9 and 10 are intact as well. I'm gonna wipe that on him. So that's good. Alright, so the next thing we'll move on down to is his chest. So I already palpated his chest when I did his scan, so I don't have to do that again. I also look over it just at his respirations and make sure I don't see any abnormal movements of the chest, which I did not, just his normal respirations. So next I will check out his anterior to posterior ratio with the transverse side of him, and it should be 2-to-1, which it is in this state. And I'll also check his make sure he has symmetrical expansion. So I have you stand in front of the camera, and I'll put my thumbs at T9 and T10, so I'll just get down with this. And I'll have, put your arm down. And you just take deep breaths in and out. And again. Alright, and with that, my hand should rise with him and expand with him. And it did. Alright, so go ahead and sit down. So that's good. So the next thing we'll do is we'll auscultate his lungs, and then we'll move on to the heart and the radial pulse, and then we'll be done. So with the diaphragm, I'll go ahead and take a listen to his lungs, anterior, posterior, and laterally. So we'll go next to the camera so they can see. So anteriorly, up, and oh, you don't know what that means, in the front. All right, so this is right side, this is left. So right upper lung, left upper lung. And just take deep breaths every time I put it down. Left lower lung. Right lower lung. Right lower lung. Left upper lung. Alright, and then we'll do posterior, so the back. My bad. Okay, so now he's reversed. So left upper lung. Right upper lung. And we gotta do it under the scapula, so kind of move it in. Right lower lung. Trying to feel for a scapula, okay. Left lower lung. Then we have left lower lung. Right lower lung. And then you can listen in more on this side. So right lower lung again. And then left lower lung. More laterally. So then we'll turn him to his right. And we'll listen to it laterally. So we have right upper lung. Right middle lung. right lower lung. Okay, and then to the left. So you have left upper lung and left lower lung, kind of right here. Okay, you can go ahead and take a seat. So I didn't hear any abnormal sounds. I just heard that his vesicular sounds. So that's what we want to hear. So next we'll listen to his heart. I shouldn't have said you sit there, I'm sorry. So first we'll listen to his heart, and we'll listen for any like ticks or any such or abnormal sounds such as a heart murmur. So first we'll listen to it using the diaphragm side, and then we'll use the bell side to hear further murmurs. So first we listen to the aortic area. Pulmonic. Erb's point. Tricuspid. And mitral. Next, I'll switch to the bell side. I didn't hear any abnormal. I just heard S1 and S2, which are noted. So again, we do aortic, pulmonic, Erb's point, tricuspid, and mitral. All right, and again, you can sit down. Again, I didn't hear any extra sounds or heart murmurs. So next, we'll check his radial pulses. Good. Okay, let me check this one. Okay, and his pulses are 2+, they're strong, and they're continuous, so that's what we wanted. Do you have any pain?
No.
You good?
Yes.
Alrighty, so I thank you, Mr. Banks. Your assessment went good. Alright, and I thank you guys for watching.
All right.